Welcome back to my channel. Today we'll be talking about cancer, and not just any cancer, it's cancer in children. Thank you so much for choosing to be here. I'll be your host, Irene Oira. Before we dive into our topic, let me first of all explain what cancer is and the two types of cancers that are there. So what's cancer? Cancer is basically overmultiplication of abnormal cells within the body. And we have two types of cancers. We have benign and malignant kind of cancer or tumors. So malignant and benign types of tumors. So what is malignant type of cancer? So malignant type of cancer, this is the type of cancer that the cells in the tissue multiply so rapidly, and by the fact that they're multiplying so rapidly, the spread is also rapid in the body, and it also spreads to various parts of the body. Benign types of cancer, this is whereby the cells multiply but now form a tumor within the body tissues. So, and the spread is not as fast as malignant kind of cancer, and in most cases the benign types of cancer doesn't spread within the body. When it occurs at a particular place, it forms a tumor, and that's when you're now diagnosed to be having cancer. And for malignant type of cancer, there'll be that multiplication within the body. The most common examples of malignant tumors are liver tumors, lung, brain, and bone tumors. It's also good to note that cancer in children is not as common as cancers in adults, because you find that from research, it is roughly estimated as 15,000 cases are detected every year, as compared to adult cancer, whereby averagely of about 1.8 million adults are diagnosed with cancer every year. So you see, it is not as common as adult cancer, but it doesn't really mean that it's not there. It is there. We have three most common types of cancers in children. One is leukemia, or the blood cancer. 2, the brain tumors. 3, lymphomas. Lymphomas, these are the kind of cancers that affect the lymphatic system. And what are the most possible early signs to look out for in children? So you find there'll be constant night sweats. You have pain in a particular part of the body. You have abnormal lumps in within the body. There is nausea and vomiting. Constant complaining of feeling tired or fatigued. Or you find that this child is used to being so active, so being all over the place, but now for some time now the child is just not happy playing. The child is not as active as he used to be, and when you ask the child if he's able to interact or she's able to interact, she complains of feeling tired so often. Also, there is unexplained fever. You find that the baby experiences some episodes of elevated fevers more often within the day. Loss of appetite is another symptom, and unexplained weight loss is also a symptom to watch out for. So if you have observed or you are observing most of these symptoms that I have mentioned and you are in doubt, the best thing to do is to take your child to the nearest facility for screening and assessment, and the doctors are going to handle the matter from there. So be it cancer, be it not cancer, it's good to just clear your mind concerning the symptoms that you have observed. So just to mention, cancer is the second most leading cause of death in the world today. But the good side is that we have also improved in our screening, in our treatment and prevention of cancer. So the earlier you learn about it, the earlier you are screened, the earlier you know about it, the earlier you are treated for it, the more you increase your chances of survival. So that's it for today, and see you in our next video.